We're going to demonstrate some cervical spine proprioceptive exercise real quick. We have a lot of patients that, whether it's, take a fall, a car accident, where they get a little bit of whiplash, like an acceleration, deceleration injury, you name it, whatever it might be. And if you've been one of those cases before where you get some muscle splinting and spasming in the cervical spine, it's just extremely painful to do any movement whatsoever. And it's if it's hard to even move, it's going to be even harder to do anything with resistance. So one way to build back that postural tone is through proprioception. So the best way to do this is to use, obviously, some TheraBanding. The green is probably the right amount of resistance. So, and the nice thing about this is because it has such a big surface area, you can put it and wrap it on the side of the head, the front of the head, and the side. You'll see me do it in just a second, but it's going to look kind of silly. But the whole premise behind doing this is to maintain good postural balance with the cervical spine, hold it in that position, and then you're going to use some stimulus, like you'll see me with my arm coming out this way, this way, this way. Now it's going to be really hard to come back like that, so what we typically do is have a partner help you with that one, but you'll see it's going to kind of maintain that tone, and you got to maintain balance with the resistance going in what direction you're actually pulling from. So we'll start from the side first. Again, you can see how they get the surface there. It's really hard to do this with the real skinny bands, so it's much easier with something like this. So grab them around attention, neck retract or chin retraction, maintain that nice postural balance, and what we're going to do is just add a little bit of variable resistance to it. You can hold this for probably 30 seconds. Again, when you first start doing this, it's probably going to be a little painful, but what you'll notice is that all these little small postural muscles in the side of the neck over here are really trying to fight that motion, so they're going to kind of pull back and maintain that cervical curvature. You go from the back side as well, forward. Again, 30 seconds. In this direction as well, 30 seconds. Again, try this over sets of maybe 3 or 4 as you start some type of exercises, and then you can kind of work into our neck cars that we've done in the past, or maybe some cervical planking against the wall. But what this will provide will be a little bit of blood flow to those small postural muscles so you can kind of maintain that cervical balance.